Is Dr. O'Kula here? Hello. She will be our next speaker. We'll get going to the next section.
Good morning. It's actually appropriate to break and then resume with me because I'll be zooming out to the population level and sharing with you some findings from the Managing Epilepsy Well Network's integrated database on depression, and also tying it to epilepsy, which you'll hear more about after lunch. And these are findings on depression and suicidality among Hispanics with epilepsy, which is research I did while at NYU, and my collaborators are at Case Western, University of Washington, University of Texas, Houston, Morehouse School of Medicine, and I hope to continue in this vein of research, having recently joined the faculty here at SUNY. The increased prevalence of psychiatric comorbidities among people with epilepsy is well described. So we know that depression in people with epilepsy is nearly 3 times more prevalent than the general population. There is the striking bidirectional relationship between epilepsy and depression, where people with epilepsy are at increased risk of major depressive disorder, but also people with depression are at increased risk of unprovoked seizures. We also know that suicidal ideation is more common among people with epilepsy. But overall, there are conflicting reports and a paucity of literature on these psychiatric outcomes among Hispanic people with epilepsy. And now, Hispanics compose 18% of our country's population, and they're set to reach 30% by 2050, even by conservative estimates. And yet, Hispanics face marked socioeconomic and health disparities compared to non-Hispanic whites, particularly reduced use of mental health care. So this represents an area of neuroepidemiologic research with crucial clinical implications. And our study population came from the Managing Epilepsy Well Network's integrated database. What is the MU network? It's a CDC-established thematic research network developed in 2007 that over the years has come to compose 8 collaborating centers who study and disseminate epilepsy self-management interventions. What are epilepsy self-management interventions? This is a broad category, and I think you'll be hearing a bit more about self-management interventions for chronic disease today. But they broadly refer to cognitive behavioral therapy, mindfulness-based stress management techniques, problem-solving strategies, memory therapy for issues specifically related to epilepsy. And most of these are very small pilot trials at various centers. So the benefit of this database and this network is that we can pool many pilot trials for aggregate analysis. And so our study was an aggregate analysis of 10 studies within the MU network database who collected ethnicity information, Hispanic or non-Hispanic, and then also had their participants complete either the Patient Health Questionnaire 9 or the Neurological Disease Depression Inventory for epilepsy. And so we used established cutoffs to screen for elevated depressive symptoms, as well as questions on each survey that would screen for suicidal ideation. And so our goal was to compare the prevalence of suicidal ideation and depression between Hispanics and non-Hispanic adults with epilepsy. So our study population ended up being 559 people with epilepsy, and it was about a 50-50 split between Hispanics and non-Hispanics. We had 60% about identifying as female. The mean age was 42. About 40% were married or partnered, but only a third were employed, and about 50% had some level of college education. And only about 20% described their health status as excellent or very good. You can see from the bullets in blue that nearly 40% of all participants reported elevated depressive symptoms, and that was about 32% of Hispanics. 18% reported suicidal ideation among those 16% of Hispanics. And we had a subset who did provide their seizure frequency over the prior 30 days, and almost 60% had had at least one seizure in the preceding month. Now on to the good stuff, the results from our multivariate analysis of the effect of ethnicity. We actually found that Hispanics had a 44% lower depression prevalence than non-Hispanic whites in our sample. And this was after adjusting for age, sex, marital status, income level, college education, and whether or not they were employed. And we did not see an effect of suicidal ideation among Hispanics with epilepsy. What's unique about this study is that we were able to then drill down among the Hispanics with epilepsy. There were about 277, and Some of them provided what we termed acculturation measures, so they provided information on their language preference and their country of origin, whether or not they were U.S. born. And so you can see that in the total Hispanic adult sample, about 62% preferred Spanish and 46% were foreign born. And these were specifically from studies at NYU and through the University of Texas that targeted Hispanic people with epilepsy. And when we looked at if they were foreign born in terms of country of origin, Mexico and Puerto Rico were among the most common. So we also looked within the Hispanic people with epilepsy cohort into correlates of depression and suicidal ideation. And so if you look on the left-hand side of the table up there, one of the interesting findings is that Hispanics with Spanish language preference also had a significantly lower depression prevalence, 57%. And again, this was after adjustment. Other findings that are bolded were that Hispanics who reported fair or poor health status had nearly fourfold increased depression prevalence compared to people who had excellent or very good health status. And this tracks with other studies that have shown that poor quality of life and perceived stigma do affect quality of life among people with epilepsy and depression risk. Another aspect is that people who had any amount of college education had double depression prevalence among this Hispanic group, which is surprising because typically higher education tracks with better mental health, but certain characteristics in our study population may be different. For example, having some amount of college education doesn't necessarily guarantee the ability to finance its completion, and then also college education may not translate into guaranteed job access. What's not shown here is that Hispanics who reported at least one monthly seizure also had an increased depression prevalence, and that bears out with what we know about the broader literature of adults with epilepsy. If they have uncontrolled seizures, they have higher risk of depression. And so in the final minutes, I'd like to talk a little bit about why we found lower depression prevalence among Hispanics, and then within Hispanics, Spanish language speakers. You'll see on the right-hand side of the table that suicidal ideation, ethnicity, language preference, home country, those were not associated with suicidality, so we did not find significant findings. But in terms of depression, I think that even though we can't infer causation from a cross-sectional analysis, acculturation may play a role. And by acculturation, I mean the psychosocial changes that happen when people from one culture immigrate to a new host culture. There's the term immigrant paradox, which has come about from studies that have found lower rates of psychiatric and substance use disorders among immigrant Hispanics compared to US-born Hispanics or non-Hispanic whites. And this suggests that there are priorities or values intrinsic to the Hispanic immigrant experience that may buffer against culture shock. And in support of this hypothesis, the Hispanics who preferred Spanish language in our study did have a lower depression prevalence, but it's an area that needs further scrutiny, and it brings me to some of our limitations, which were that for acculturation, we could really only look at language and country of origin because certain clinical and demographic variables were not collected uniformly across all sites. Another limitation is that there's significant stigma around depression and suicidality, and so we may be seeing underreporting here as well.
1 minute, yeah.
And finally, I would say also that the self-management interventions recruit a certain type of participant, and so there may be a bit of selection bias. These may be people who are more motivated, may have more dedicated time to participate in group-based phone therapy, and so they may not be representative of all Hispanics with epilepsy, certainly. But in thinking about further self-management interventions for Hispanic people with epilepsy, I think taking into account how acculturation may build or confer some level of resilience in this population will be interesting to continue to look at. So I'd like to thank the people who invited me to speak and invited me to SUNY today, and my mentors and the folks in the MU network who do research with me, and the Epilepsy Foundation, and my crew at home.